Pathophysiology of heart failure. Heart failure is a clinical syndrome that results when the heart is unable to provide sufficient blood flow to meet metabolic requirements or accommodate systemic venous return.
For acutely decompensated disease have not improved. Across Canada, patients hospitalized for heart failure continue to suffer frequent complications, and 16.5% die during their initial hospitalization. An examination of the pathophysiology of acute decompensated heart failure identifies promising new avenues for treatment. During heart failure, the heart cannot circulate enough blood at normal cardiac filling pressures to meet metabolic
Terminology. Heart failure is a term for the chronic state in which cardiac output is insufficient in meeting the needs of the body and lungs, when termed congestive heart failure or CHF. This is when cardiac output is low and the body becomes sour with fluid due to inability of heart output to properly match venous return. Heart failure is caused by any condition which reduces the efficiency of myocardium or heart muscle through damage or overloading. As such, it can be caused by a wide number of conditions, including myocardial infarction, in which the heart muscle is starved of oxygen and dilates. Hypertension, which increases the force of contraction needed to pump blood, and amyloidosis.
Ability to meet the body's oxygen demands. The most common type of heart failure, left-sided failure, occurs when the left ventricle cannot contract sufficiently.
Heart failure results from injury to the myocardium from a variety of causes, including ischemic heart disease. The interpretation of diabetes less common etiologies include cardiomyopathies, valvular disease, myocarditis, infection, and systemic toxins, and cardiotoxins. Drugs.
This video has been taken from the heart failure chapter in the Cardiology for Finals iBook. For copyright reasons, this video has been watermarked. This is a very simplified description of how heart failure occurs to allow an understanding of signs and symptoms that the condition gives rise to. Normally, the left ventricle is able to generate sufficient cardiac output to supply the body at rest and promptly increases output during activity. However, should there be a cause for a limitation in the cardiac output due to ischemic heart disease, for example, then the heart begins to struggle. The impairment in the functioning of the left ventricle leads to the accumulation of venous blood, and so an increase in filling pressures. Initially, the body is able to sense and compensate for a fall in cardiac output through mechanisms such as Starling's law, generated by the increased left ventricular preload, and increased sympathetic activation that serves to increase the heart rate and contractility. This sympathetic activation also stimulates the renin-angiotensin system, which, among other things, causes sodium and water retention, so elevating blood volume and the central venous pressure.
Diseases. Congestive heart failure. Heart failure may also occur in situations of high output, termed high output cardiac failure, where the ventricle systolic function is normal, but the heart can deal with an important augmentation of blood volume. This can occur in overload situation, blood or serum infusion, renal diseases, chronic severe anemia, very, and thyrotoxis, Paxil diseases, arteriovenous fistulae, or arteriovenous malformation. Thank you.